Hey everyone, I haven't posted in a while, and I got a message from a friend today that mentioned how much my post helped out someone who was going through some similar health issues and made them feel less alone, and that they shared it with other people with even more serious conditions such as ALS. So I thought it's time to hop back on and say hello. I've been kind of absent from social media um, for good reasons. I've had family visiting and been visiting family, so I've been tied up with that. Also, for some uncomfortable reasons, but good reasons, I had a little procedure done. I've been having trouble with getting peripheral IVs in that I need for daily hydration therapy for my hypovolemia related to my autonomic dysregulation. So I had what's called an implanted venous access device placed. For those of you who know what those are, it's a low profile barred power port. So I will give a little warning now. Anybody that doesn't like to see medical things, don't look. But for those of you that do, I will show you. Here's a little incision. There's two incisions. There's one. And I think you can see, no, you can't see the steri strips are up here for the other incision. Oh no, they're right here. They're still there. It's 3 weeks and 5 days old. These steri strips just came off a couple days ago. The way they did it, I had it done in interventional radiology. The radiologist was incredible. And nowadays they do them through the internal jugular vein. So you can actually see a little raise in my skin there and kind of here, depending on the angle, not so much with my dressing on, but that's actually the catheter that's tunneled underneath my skin, and it goes into the internal jugular and then goes into the vena cava right before it enters the right atrium of the heart. So, and then they have to make a little bigger incision here to put the port. Now mine is accessed, so it has a butterfly Huber needle that's 3/4 inches long, inserted through my skin and into the implanted vascular device that is below my skin. And then it has a extension tubing coming off of it that I can hook IVs up to so that I can get my hydration. This is just a little biofilm there, antibacterial foam pad that goes on there. So it's all completely sealed off with transparent dressing so no little germs can get in. The danger with having this type of device, it makes my daily life so much easier because now I don't have to get peripheral IVs, which my body was no longer tolerating. So it was hard to keep up with the regular hydration. Um, I can get blood drawn from it for my labs. And now I'm getting consistent hydration. So my symptoms are so much improved. Um, Without them, I had, dizziness, nausea, near passing out episodes. Whenever I would go from sitting to standing, from laying down to sitting, from laying down to standing. Uh, it was difficult to get up and down, reach up and down, squat. It still is difficult, but it's easier, and I'm less symptomatic, and um, the intensity of the symptoms are less, and they're less frequent. Um, with the hydration, and my blood pressure and my heart rate are more in range with where I need them to be. My doctors want them to be. So it's a good thing when you have enough fluid for your brain to get the circulation it needs, and your heart and your other organs as well. So it's been really helpful for me. And now I'm excited too because I also get immunoglobulin injections, IgG, and I've been doing those subcutaneous. So I've been putting needles into the fatty tissue below the skin and infusing. I've been doing that for 6 years now, for immune deficiency. And now I'm going to do that IV. There's a little bit more risks and chances of adverse events happening doing it that way. But with my neuroautoimmune issues that I've been having, the stiff person syndrome, with difficulty walking and spastic episodes, my doctor believes, and with the autonomic dysregulation, which is usually autoimmune issues with the autonomic nervous system. Um, my doctor believes that giving a high dose once a month through the IV will help wash out all those bad antibodies. And hopefully, I'll get some improvement in those symptoms as well, while still keeping my levels high enough to treat the immune deficiency, because my levels have been consistently good doing it subcutaneously. So I had a little procedure that kind of set me back a week. It wasn't very invasive, but any kind of procedure, it takes time to recover, especially when you have chronic illness and a multitude of issues, because anything just throws your body out of whack. If you ask my mother and my mother-in-law, who were with me for the week, and my husband, they will all attest to the fact that I wasn't feeling too good, and therefore I wasn't the nicest person to be around. So please, if you are a caregiver or a family member, have patience with your loved one who has any type of chronic illness, chronic pain. I always thought I understood it as a nurse, and a nurse who dealt with patients with chronic pain. I was as compassionate as I could be, and I often got the more challenging patients because I was willing to kind of deal with them. And a lot of people, kind of thought it was all in their heads and didn't have the patience for them. And I'm glad that I was compassionate, because now I understand. I have a much better understanding that it's very difficult to put on a happy face when you are not feeling so well. Um, So that pause was my husband coming into the room, and which was a good thing because I forgot to take my meds. So I needed to take a little pause to take my nightly meds. Okay, so the meds are in, which anybody that knows me knows that I don't really like taking medications. So, and medications don't really like me. So if you're a care or provider, nurse, doctor gets the patient that has the list of 20 to 30 allergies, and you're like, there's no way they are allergic to this many medications. Well, they're probably not, but they're probably sensitive to them, and they may have something that I've found out that I have is mast cell activation syndrome, and it makes us where we have allergic type reactions to many medications, foods, chemicals. Um, Fragrances. So it's difficult to be out in public. It's difficult to go out to dinner. It's difficult to find medications that you can take that don't make you um, sicker taking them than not. Um, also discovered that a lot of medications have lactose in them. So if you're lactose intolerant and you get nauseous every time you take your medications, that could be why. I actually have dairy allergies. So lactose in my medications is a big no-no. And they are in most every tablet. So just a little FYI out there. I request liquid medications whenever I can get them. It also helps when you have to take a lot of medications, because I and many people that have syndromes like me have trouble swallowing sometimes. So medications can get stuck or just be difficult to take. And I don't want to have to miss doses because I can't swallow them. So, excuse me, a little burping there. Um, Probably from trying to get my medications down. Um, so I'm getting a little sidetracked here. I didn't really have an agenda other just to kind of check in and say hi. I'm still here. I've just been busy. And I haven't been feeling that great. Luckily, the last few days I'm feeling better. My doctor's been trying me on some new medications. So I had some bad side effects. So I had to stop a few. And then one he put me on that will hopefully, it's like a histamine blocker. So hopefully it'll help me tolerate some of my other medications that maybe I can restart and retry again. They're trying to get me so I'm not so dependent on hydration. But the medications, I'm one of those people that often has the paradoxical opposite effect of medications. So medications that are meant to raise your blood pressure for me drop it even lower, and I have low blood pressure. That's why I need to take them. So um, the fluids work, but they don't want you to be on that permanent. It's not ideal to have permanent access because the risk of infection, something going directly into your heart, very close to your heart, is not a good thing. Anytime you have anything foreign in your body, especially a blood vessel, you can get a clot um, on the catheter so that it no longer works, or that could break off and, could cause some sort of blockage. Could be minor, could be a deep vein thrombosis, could be, um, well, um, it's more likely to go into the heart because my catheter is going, right close to my heart. So could be end up getting a pulmonary embolism and can actually even cause death. One of my doctors really didn't want me to get this done, but for me, it was the right decision. I've been on peripheral IVs for 2 years, and my veins just weren't having it anymore. I was having local reactions; they were leaking. It was consuming my days and nights. Trying to make sure I had a vein that worked. So this has been great for 3 weeks now. I've had continuous hydration, and I get vitamins through those as well, and which made us realize that I really do have an absorption issue because I'm the vitamins I'm actually seeing the benefits from versus trying to take oral vitamins. Um, so, anybody with chronic illness, mal, malnutrition and hydration are serious issues, especially people with dysautonomia, problems with their autonomic nervous system. We have trouble with dysmotility, with digestion, often have acid reflux, GERD, nausea, and vomiting. Um, Many people end up on feeding tubes. I haven't had to do that, but I did have to puree foods for a year and eat basically sweet potatoes, beets, and squash, sometimes applesauce, and a lot of vegan cheese. So I try an avocado. I could eat avocado. So I'm very happy that I'm able to eat and tolerate avocados and nuts because I live on nut butters. I try to get a lot of calorie and protein dense foods in when I can. And some days when you have chronic illnesses, you just don't have the energy to eat, don't have the energy to drink. When you have autonomic dysfunction, you can't get your head off the pillow. So, can't get your head off the pillow, it's difficult to eat and drink. So, I'm not trying to give a sob story here. I'm just trying to like share what the days can be like dealing with these sorts of things so that maybe those without can have a little more compassion for those who are living with it, and those who are living with it can feel a little less alone. I have been making videos. I haven't been posting live. This one I'm recording and will post. But more like instructional videos and hints that I've learned along the way dealing with some of my issues. So they're not more, they're more specific. They're not just general. So I'm hoping to post those on YouTube soon, and hopefully they'll be helpful. So if any of you out there have any questions or suggestions for videos you'd like to hear from me, and the only reason not the only reason I'm doing that. I'm doing that because I found at being a patient, being in the medical field since I was, you know, 16 years old, being a nurse practitioner, nurse anesthetist, working in surgery for so many years. I have insight into a lot of these medical issues, and having some experience. I don't know how I got it, but basically helping my father apply for disability. I applied for my own disability, trying to work through, insurance issues, and now being on Medicare, that's a whole different story. So my days are literally spent um, dealing with my health issues and or you know dealing with insurance companies. And if I have an event that I need to go to, it takes all day preparation. I was fortunate enough to go to one of my best friend's grandchildren's um, plays yesterday. And it was in the evening, and my ride was picking me up at 3 o'clock, and it took me all day to get ready. And I was able to go and attend, and I made it through it and felt good. Came home, slept well, and didn't pay too much for it today. So, yay. So some days are good. Some days are better than others. And, I can pre-plan for that. I can medicate for that. I can um, hope for the best. Sometimes it works out and sometimes it doesn't. Yesterday it did. So it was really nice to reconnect with some people I haven't seen in a long time. And it was really great it's really great and really important. That's one thing, like I really am homebound. I don't drive. I'm reliant on others to get out and about. And that in and of itself can be very depressing, demoralizing. So, and frustrating, especially if you're someone who, like me, who is always very independent and always on the go. So, when I am able to get out and be around friends and reconnect with people, just, it helps my mental health, and which um, may have had a glitch there. I've been a low battery, so I probably ought to get off here, but helps me mentally, which helps me physically. They both go hand in hand. So, like I think I've said this before, if you have friends who have chronic illnesses that have fallen off the map, reach out to them. It's probably because they just don't have the energy to reach out. Um, if you are someone who is suffering and you don't have the energy to reach out, maybe just try sending a text and saying, "Hey, I miss you," and be surprised what you might get in return. Um, I'm working on being more compassionate for my caregiver, and having more patience with him and not expecting him to read my mind, trying to work on my communication and trying not to take out all my frustrations on him, because it's not fair to him. But it gets frustrating to me because I know he can escape it and I can't. And sometimes, even though I don't want to resent him for that, I do. But I notice it, I acknowledge it, and then things get better. Sometimes it takes talking to my therapist to come to that realization. So I highly recommend, if you're dealing with chronic illness, to get yourself a therapist. Just a, you know, talk therapist, because your family and your friends don't want to hear about it. You don't want to whine about it. You get tired of talking about it. But some things you just gotta let out in a safe place. And sometimes just letting it out, it disappears. So, anyways, that's homie's thoughts for the day. I hope you all are doing well. Stay safe. Take good care of yourselves. Take good care of each other, and be well. And hopefully, I'll be able to post more regularly. I'm trying to. There's some things I've got to get done, like taxes, and then I'll be able to focus more on, um, just sharing and helping and advocating. So I look forward to the next time I'm able to reach out this way. Take care.